Good afternoon, everybody. Good morning and good evening as well. I see we have a few groups from a couple different time zones. We're going to wait a few seconds just to allow everybody to log in, and then we'll get started. All right, it looks like registration is now closed, so we'll go ahead and begin our presentation. So my name is Dr. Brett Wisniewski, and we're here to talk to you about the fad and facts. It's the science behind dieting. I find this very important because there's so many renditions out there of different diet programs, magic pills. So I thought it was really, really important to kind of go over what the science shows, what is in the proven research, and then also clinical outcomes. And hopefully by the end of this presentation, we'll dispel a few myths that are out there and also give you guys a good baseline to follow to get you, some good results overall. So of course we have to start with a few disclaimers. I pride myself in providing the most up-to-date research, literature, and clinical outcomes. The following has not been evaluated or approved by the FDA or its governing bodies. Recommended dosages are for adults, and as always in any treatment, it should be monitored by a licensed physician. I do not encourage any person to lessen or discontinue any prescription or prescribe nutrition without consulting the prescribing doctor first. This is really important. You want to create a team with your physicians, whether it's one individual or multiple, and it's really important. Whatever changes you do, you discuss with them. Even if it's not under their direction, you want to keep them informed so you guys can make the best health decisions as a group. So, content disclaimer. By human nature, we're always striving to make things better or alter it for ownership. This statement holds true in the diet industry. There may be some, diet protocol that's been around for many years, and we get a new spin on it nowadays just to add ownership, create some sort of marketing frenzy. So it's very, very important that we really look at the hard evidence to the origin of some of these diet claims. There's many variations in the research pertaining to things such as carb backloading, paleo diet, ketogenesis, intermittent fasting, and many others. What we're going to go through in this presentation is the strictest form. What the diet or prescribed nutrient was intended to do, not necessarily what marketing has taken over. So why we're all here, this is the fad and facts behind dieting. We're going to go over diet and dieting basics. We're going to touch on digestion. It's important to understand how the body functions as a whole. Then we're going to look at how the body actually creates energy from foodstuffs that we eat. We'll touch on ketogenesis, which is actually fat-burning metabolism, which is going to be very interesting for you guys to see how well our body can function if we can force it or encourage it to burn fat. And then we're going to dispel some common myths, hopefully. Are smaller meals better for weight loss than just a few larger meals a day? Do we consume low fat for fat loss? Is breakfast actually the most important meal of the day? Is it true that a calorie is just a calorie and restricting calories as a whole will net a weight loss regardless? And then fasting, is it only for religion, or can we actually see some performance from it? Some performance and weight loss, and we'll see if we can figure that out here by the end of the night. And then we're going to touch on paleo basics. This is pretty big right now in the media. The paleo diet, paleo Mediterranean. We're going to touch on what exactly it is and how you guys can incorporate it into your life. And then, of course, at the end of the day, we're going to touch on my opinion and recommendations. I have a bunch of patients that are just like, you know what, doc, enough with the science, just tell me what to do. So we'll have a few slides to summarize what we went over tonight for those individuals that are following along. So we got to put a little humor in it. You are what you eat. If you want to reach a ripe old age, eat a lot of brown bananas. So let's fire things off with the definition of diet. This is what we're going to be discussing throughout the night, so it's really important we have a good foundation on what exactly a diet is. The diet is kinds of foods that a person, animal, or community habitually eats. A vegetarian diet, a carnivore diet, a caveman diet. Or it can also be a special course of food to which one restricts oneself either to lose weight or for medical reasons. Quote unquote, I'm going on a diet. Whenever you tell somebody I'm following a specific diet or I'm going on a diet, in society we really think that number two is what we're talking about, when in reality we're all eating some form of a diet, regardless if it's strictly fast food, which obviously we don't encourage, or if it's salads and chicken. Everything is a diet. So it's really important to kind of get that out of the way. I put this slide in here. I thought it was pretty interesting. This is the evolution of a diet. We're not going to spend too much time on it, but like I said, I thought it was fairly interesting when some of these things came into vogue. So in 1825, you actually see the first low-calorie, low-carbohydrate diet come into play. In 1903, a gentleman by the name of Fletcher, Mr. Fletcher, implemented that everybody should chew their food 32 times for the best absorption. And he wasn't completely wrong, and that's in 1903. That's pretty interesting. The first calorie counting diet was 1917. In 1925, this is where we start to see a huge rush in marketing, and the cigarette diet was in. So reach for a Lucky instead of a Sweet. For those of you who don't know, Lucky was a brand of cigarettes back then. 1970, there was the Sleeping Beauty diet. They would actually heavily sedate you for several days, and what this would do was obviously restrict calories. When you're not awake, you can't eat. So they would put you to sleep, and you would essentially lose weight. Of course, once you woke up, you would be hungrier than ever, and chances are your weight loss would be negated by any kind of rebound weight gain. 1994 was the all-famous Atkins diet. This was high protein, low carbohydrate. 1996 was Eat Right for Your Blood Type. This was put into mainstream by The Book, which some of you may read. 2000 was the raw foods. This is when we started to see the push for reaching for organic foods, specifically the unprocessed organics. And then 2006, which is through my research to create this presentation, was news to me. There was a maple syrup diet, which consisted of syrup and lemon. So we're going to go over the basics now. Like I said before, when we kind of had the definition behind what a diet actually is, we really need to see the basics on how the body functions. We need to see what happens once we intake food. And ultimately what the body is trying to do is take these large foodstuffs, break them into macromolecules, or something that's a little bit smaller, and then break them down into micronutrients, which are our vitamins and minerals. So let's look at the macronutrients. We have carbohydrates, proteins, fats, and alcohol. If we see here, a carbohydrate will net us 4 calories per gram consumed. Now, a calorie is simply energy. This is how much energy the food will give us. Protein will also give us 4 calories per gram. Fat will give us 9, and alcohol will actually give us 7. If you look over here, we have some macronutrient ratios. These aren't per se what somebody should follow if they want to be a bodybuilder, if they want to maintain their weight, or for fat loss. But this is just something I found online that was a good pictorial of different kind of percentages that could be followed to reach a certain goal. So we're going to look at a few pieces of research tonight, and we have to go over some terminology. Energy balance is often used, or the thermic effect of food. Energy balance is simply the equation of calories in compared to calories burned. The thermic effect of food is the amount of energy it takes your body to break down that food into micronutrients. So these things come into play when we talk about the overall, like I said, energy balance of the body. How well our body is actually burning the calories that we're taking in, and then which areas are the most effective in that. And what I mean by this is this pie graph right over here. So we have the blue section, which is the resting metabolic rate. This is kind of what's just happening while you're sitting here watching this presentation. The red section is what we explained before, the thermic effect of food. It usually makes up a smaller percentage than the resting metabolic rate, obviously, because we're not eating all day long. And then we have activity thermogenesis. This is opening and closing the car door, brushing your teeth, hopefully some exercise in there. This is a day-to-day activity will make up the second largest portion. Let's talk about lean muscle mass really quick. This is important because this is something I ask all of my patients to do. You want to increase lean muscle mass. So it's not just about running on the treadmill anymore. It's not just about yoga. It's not just about weightlifting. It's not just about any of those things. It's really a combination. And the overall goal, if you are trying to lose weight, should be to increase your lean muscle mass. And the reason why is it's a pretty simple equation. So a calorie, like we said before, is energy. You will notice in America we use just the term calorie, but it's actually a kilocalorie, which is denoted by this K here. So we'll use those two interchangeably throughout the presentation. A calorie equals, like I said before, heat energy. If we look at this equation right here, 1 pound of active lean muscle burns about 30 to 60 kilocalories per day. So if we put 10 pounds of lean muscle on someone's frame, and we took an average of the amount of calories burned, 10 pounds times 50 calories will equal 500 calories per day. And if we took and extrapolated that, that equals about a pound a week in weight loss. If we then took that number, times it by 52 weeks in a year, we have 52 pounds of weight loss in 1 year. Now, we all know out there who've tried this isn't just a one-to-one. We're not going to put on 10 pounds of muscle and then all of a sudden we're going to lose 52 pounds in 1 year. There's a lot of other things that come into play. Weight loss is multifactorial, but if we're just looking at how much 1 pound of active lean muscle burns, you can see how important it is to actually start packing on some extra pounds in the muscle category. Let's touch on digestion. It's important that we have proper digestive time for multiple reasons. Number one, we want it slow enough to allow our body to break down food and to get the nutrients we need to push different energy cycles, to allow proper detoxification, hormone balancing. But then we also don't want it too slow to where we start to build up and become toxic. Same thing on the flip side. We don't want it to be too fast because then we don't give the body a chance to actually absorb anything. So once we ingest food, about 50% of your stomach contents should be emptied in about 1 hour. 2 hours after that, it should be completely gone and into the small intestine. If you're one of those individuals that has a meal and it's just kind of sitting really high up, feel like it's still stuck in your stomach a few hours after, you probably have really sluggish digestion, and that's something you want to address. After it empties into the small intestines, about 1 to 2 hours later after that, 50% of the small intestines should actually be emptied into the large intestines. Once in the large intestines, complete transit time happens within 12 to 48 hours depending on the patient and what they ate. From mouth to anus, we should see that time being anywhere between 12 and 48 hours. Like I said, too fast, we're running into an issue of malabsorption. Too slow, we're running into a problem of possible toxic buildup, which could also lead to malabsorption. So how can you guys test this? It's really easy, actually. If you go to the store, get yourself some nice organic beets. You are going to prepare yourself some beets, whether you want to blend them up, bake them in the oven at a low temperature, or just eat them raw. You're going to look at the time that you consume the beets, and then you're going to actually, every time you have a bowel movement, you're going to inspect it to see if it actually turns a slight red color. From the time you ate the beets till you see the slight red color in your stool will be your transient time. Ideally, we're looking for around 24 hours, maybe a little bit faster. Anything longer than that, we really start to see some health issues pop up. Within 24 hours, you should be clearing your food from the day before. We're consuming all of this food to do what? Our body needs to produce energy. And the way we do that is by breaking down the food into those macronutrients, and then from those macronutrients into micronutrients. And ultimately, we're trying to shuttle those nutrients into something called the mitochondria. If you look up here, and I know it's kind of small, let me see if I can get a pen up. Here we have the human body. The human body is made up of systems. The systems are made up of individual organs. Those organs are made up of tissues. The tissues are made up of cells. And then we have these things called the organelles. The organelles are kind of like organs to the cell. They're really, really small. One of the major organelles we have are the mitochondria. They're present in most cells in the body. Some cells have a few more than others. We can have many hundreds or we can have one. As an interesting side note, we inherit most of our mitochondria, or all of our mitochondria, from our mother. This plays a pretty big role when we start to talk about autoimmune disease, with mitochondrial medicine being the forefront of treating these autoimmune conditions. We always want to find out, why are we talking about the mitochondria? Well, the mitochondria, these are the very basis for energy. This is where the energy cycles happen. Energy is made in the Krebs cycle in the form of what's called ATP. ATP, in simplest terms, are like money. We're producing energy money for the body. I found this little quote in one of my biochemistry books. It's just as commerce is facilitated by the use of common currency, the commerce of the cell, which is metabolism, is facilitated by the use of common energy currency, adenosine triphosphate, or ATP. So like I said, we are looking to produce energy. And this all happens in those little organelles called the mitochondria. We'll take a quick break for a cartoon. I must be eating right. I'm narrow at the top and wide at the bottom, just like the food pyramid. And, we all probably giggle when we see this, but this is a real big issue right now in our country, is that we're following poor science. The food pyramid is not the way we're supposed to eat. Recently it's come out the My Plate. That is something else I don't encourage following. And you'll see kind of why as we go through this tonight, why we shouldn't be, really hanging our hat on these different concepts, because they're just really not rooted in science. It's more politics and financially driven by different industries. From food to usable energy. Like I said before, we're talking about food, then we talk about macronutrients, we're getting into micronutrients, we touched on the mitochondria. Well, what exactly is happening? So we consume a carbohydrate, a protein, and a fat. Our body then makes something called acetyl-CoA. Acetyl-CoA is then shuttled into the mitochondria, and the mitochondria produces ATP, or that energy currency. It's important to know the nutrients that aid in this process. The nutrients are oxygen, calcium, magnesium, potassium, phosphorus, copper, CoQ10, vitamin C, a B complex, lipoic acid, and L-carnitine. These all aid in some step or another to help push this energy process. Where could we get most of these nutrients from? As simple and cost effective would be a multivitamin. Multivitamin would supply you with the easiest way to get a lot of these nutrients. And it's usually very cost effective if you find the right multivitamin. These are your macronutrients again. Like I said, the carbohydrate, 4 calories per gram, protein, 4 calories per gram, fat, 9 calories per gram, and alcohol, 7 calories per gram. Looking at this, which would you guys prefer to burn for energy? What is going to give you your best bang for your buck? It's going to be fat. You get 9 calories per gram from fat. This is called ketogenesis, where ketogenesis will take fats, create ketone bodies. These ketone bodies can then be used for energy. In fact, ketone bodies are the preferred energy source of the brain, nerves, and actually heart tissue. And we're going to see some research on that. So this was a study published in 2006. It was the neuroprotective and disease-modifying effects of the ketogenic diet. Ketogenesis has long been studied in epilepsy. Strong evidence exists that ketogenic diet protects against seizures in children with difficult-to-treat epilepsy. Recent reports have raised the possibility that the diet may also improve the long-term outcome in such children. This is simply by just changing the diet, eliminating the sugars and simple carbohydrates, increasing the good fats, and forcing the body into this very valuable pathway. Other research has been raised to show the possibility that the ketogenic diet could provide symptomatic benefit and might even be disease-modifying in Alzheimer's. Parkinson's disease patients experience a mean 43% reduction in Unified Parkinson's Disease Rating Scale after 28-day exposure to the ketogenic diet. All participating patients reported moderate to very good improvement in symptoms. So we're no longer just seeing a diet to produce a certain aesthetic look, to fit in a bathing suit or to get into that wedding dress or to look good on vacation. We're now starting to see that what you put in your mouth can actually modify how your body functions. And in these individuals with epilepsy, Parkinson's, a lot of these neurodegenerative diseases, it can literally be life-changing just by altering the diet. It's really important. I bring up this quote: all truth goes through 3 stages. First, it's ridiculed, then it's violently opposed, finally, it's accepted as self-evident. We see that all the time. A lot of these concepts that we're seeing are very politically charged and financially driven. So it's important to really find out what is research, what does the science say, and above all else, what are the clinical outcomes? So here's a broader look at ketogenesis. Ketogenesis is engaged when the body no longer has glucose or sugar to burn for energy. How do we do that? We need to limit sugar consumption. Once we limit sugar consumption, the body then turns to the liver and asks it to release all the sugar it has. Once the liver dumps all the sugar it has to burn for energy, we then start to create these ketone bodies. These ketone bodies are formed when the body prefers fatty acids to burn rather than sugar. And like I said, we can do that by, I hate to use the term force, but we can push the body into the favorable ketogenic pathway by limiting sugar consumption. For a healthy individual, limiting sugar and simple carbohydrates to less than 30 grams a day can put you into ketosis within 72 hours. Now, the first time you enter into ketosis, you may have what's somewhat described to me as like detox-like symptoms. You can have a little bit of a headache, you can get a little bit nauseous, but those will go away. So, like I said, once we start preferring these fatty acids for energy, they get shuttled into that little organelle called the mitochondria. The mitochondria then produce a tremendous amount of ATP. So we're getting a lot of energy, and then we have these ketone bodies, which once again are preferred by the brain, nerves, and heart as a fuel source. And then this is a brief overview of what happens. So we do carbohydrate restriction, healthy individuals, less than 30 grams a day. We should have complete depletion of liver glycogen, or the storage form of sugar in the liver, within 48 to 72 hours. Then we will actually liberate fats from our frame and also what we take in from the diet. We will send those into the citric acid cycle. We will then spit off ketone bodies via the ketogenesis, and the heart and the brain, once again, prefers this fuel source. So why is this important? Not only is it important, as you saw before, it's possibly disease modifying, but if we look at simple math here, if you burn fat, you create more energy more efficiently. Efficient energy creates an efficient body. Here's one column here, if my math serves me correctly. We have the burning of glucose, and then we have the burning of fatty acids, or the ketogenic pathway. We can see we actually get 40% more ATP per molecule when we burn fats for energy. Not only are we trying to avoid consuming sugar to push this beneficial ketogenic pathway, but a lot of research also shows us how harmful sugar can be to our immune system. Glucose, which is a sugar, can actually create more reactive oxygen species. The issue with this is not only are we getting the acute incidence of this upregulation of these reactive oxygen species, we are also seeing it being prolonged after sugar consumption. If we look at the standard American diet, where we wake up and we have, the bagel with cream cheese, and we have the sugary cappuccino, and then a few hours later, we have that snack. A few hours after that, we have a big sandwich for lunch with a bag of potato chips. After that, we come home, we have pasta, or we have pizza. Every few hours, we're inducing these free radical, or these reactive oxygen species, from introducing simple carbohydrates into our diet and sugars. If we see in this study, this actually decreases antioxidants for up to 3 hours. We're looking at another study here where they took 100 grams of carbohydrates. These carbohydrates were sugar sources. So we're talking about glucose, sucrose, fructose, and then there was even some quote-unquote natural forms of sugar like honey and orange juice. It's important that we notice that we're not just talking about glucose here, that we're talking about sugar that comes from fruit, we're talking about some table sugar, and then we're talking about naturally occurring sugars as well. So we're not just pointing the finger at one form of carbohydrate or one form of sugar. It's any kind of sugar that you consume. And they found that all these forms of sugar at a 100-gram portion significantly decrease the capacity of neutrophils to engulf bacteria. Neutrophils are part of our immune system. They help fight off infection, especially bacterial infections. Even more profound is this lasted up to 5 hours after feeding. So we have here from this study that it decreased antioxidants, which leaves us exposed for up to 3 hours. And then this study showed just a 100-gram portion of glucose, fructose, sucrose, or naturally occurring sugars significantly decreased the capacity for neutrophils to engulf bacteria up to 5 hours after eating. So like I said, we're seeing individuals eat multiple times a day, and they're usually high sugar foods. So this is really important, another reason why we want to avoid sugar. So let's start getting into some of the dieting and some of the dieting tips. The goal of any diet is either to increase energy, lose fat, build lean muscle, sustain life and vitality, a certain look, financial, some powerlifters and bodybuilders make their income off of the way they look or perform, and then sports performance, whether it's just for recreational sports or college scholarships, whatever it may be. Your goal will actually dictate your plan, really what you want to do. So are we trying to be a high-energy sprint athlete? Are we looking to perform a certain way, looking to have a certain aesthetic appearance, or just looking for overall health and vitality? And this is where we're going to start getting into some of the myths that surround dieting. So this is pretty legendary that fat makes you fat. And I hope by the end of this we'll see that this isn't completely true. So the myth is eating fat makes you fat. The problem with that is fat is absolutely essential for vitamin D production. Vitamin D, we can have a whole talk on vitamin D and its health promoting effects. Fat is important for mineral absorption because we actually create what's called bile salts from fat. Bile salts help us break down these fatty nutrients such as vitamin A, D, EK, and CoQ10. Those are just to name a few. Every cell membrane in the body is actually made up of fat. Nerve tissue is surrounded by fat. Immune function is dependent on fats and actually helps us regulate our T cells, which are important in immune function. And then all of our sex hormones, testosterone, estrogen, those are all actually made from cholesterol, which is a fat. So what goes along with this fat phobia or this fat myth is that egg yolks increase cholesterol. So I treat a lot of professional athletes, and I always make everybody do a diet log, and when I look at it, it's always 6 egg whites in the morning, 3 egg whites, egg whites, egg whites, egg whites. Where are the yolks? Well, I don't want high cholesterol and things like that. Well, if we actually look at the research, that isn't actually true. So when compared to the yolk, the white of an egg is deemed useless if not accompanied by the yolk. And we'll see this here in a second. I actually created a chart for you guys. The reason why is a lot of vitamins and minerals are actually found in the yolk, where the white is just giving us some proteins. So here's a quote from the longest-running heart study, the Framingham study, which was started in 1948. Majority of individuals who develop coronary events are not in a high-risk group. So what is a coronary event? We're talking about some sort of heart attack. According to the Framingham Risk Assessment of Traditional Risk Factors for Coronary Heart Disease. And because 1/2 of those who suffer myocardial infarction have normal lipid values, measurement of inflammation markers has been suggested as an adjunct to lipid testing to better identify individuals at risk. What does that say in simplest terms? What it says is that we see that half of the individuals actually have normal fat values, which was in the past, this is the only thing that we were worried about for risk of heart disease. But in this study, most of the individuals half of the individuals are not in the high risk group. So what that means is there's so many other things that go into, heart disease and the prevention of heart disease, and we can see that they suggest that you measure inflammatory markers. Well, these inflammatory markers can be decreased or mediated by a lot of these nutrients that we get with proper fat absorption. So let's continue on with the yolk versus the white. What I did here is I highlighted, if you can see there's multiple columns, we have the nutrient we're looking at. This is the egg white, this is the egg yolk, this is the percent total in the white, and this is the percent total in the yolk. I made it really easy. I highlighted all the things that were above 50% in the yolk as far as nutrient goes. So we can see there's only 5 things that we get a little bit higher in the white, and one of them we knew, which was the protein. Obviously, we can see from a nutritional standpoint, the yolk is much more beneficial for us. Another reason we want to consume the egg yolk is because we get something called choline from the egg yolk. As we see here, choline can be got from some organ meats, which aren't really incorporated in our diet too much anymore. But the third highest one in the standard American diet is actually the egg yolk at 126 total milligrams of choline. What that means is that we're going to get a lot of neuroprotective effects from eating an egg yolk. So consuming both the yolk and the white gives you the greatest nutrients. But if you had to choose one, I would choose the yolk. Yolks are also very high in choline, which improves all functions of the body, especially neurologic functions. So here's a study that we found, the health benefits of consuming the whole egg. And you do want to eat farm fresh eggs as much as possible. Those egg substitutes don't apply. They did measure whole eggs here. So whole egg consumption improves lipoprotein profiles and insulin sensitivities to a greater extent than yolk-free egg substitutes in individuals with metabolic syndrome. We'll break that down here in a minute. Incorporating daily whole egg intake into a moderately carbohydrate-restricted diet provides further improvements in the atherogenic lipoprotein profile and in insulin resistance in those individuals with metabolic syndrome. What does that mean? That means that consuming the whole egg with the white and the yolk that's full of, the quote-unquote bad cholesterol, we actually saw better cholesterol profiles in these individuals that are susceptible to having negative cholesterol profiles or bad cholesterol profiles. And it also helped with their insulin resistance or their ability to metabolize sugar, which would lead to more energy production and more fat loss if that was the goal, or better sports performance. So eating the whole egg is the way to go. Here's another pretty big myth out there in the diet industry, that a calorie is a calorie. So if we just all you need to do to lose weight is restrict calories. And this became pushed even more when two individuals, in their infinite wisdom, wanted to prove a point. Two professors of two totally different institutions, one ate only potatoes for about 60 days, and the other one ate only junk food for about 60 days. They both lost a significant amount of weight. If we look at this and why, look at the term of the study. We're looking at 60 days. Restricting calories at 60 days in a healthy individual will net some weight loss, just calories alone. But as soon as we reach a certain threshold, the body becomes more intelligent and it's searching for specific nutrients to push certain pathways. So my guess is if we took these studies out a little bit further, we would start to see the opposite effect or some kind of stagnation. We won't see any more weight loss after the 60 or possibly the 90 days. So it's really important to find out why isn't a calorie if it's just a measure of energy. And the reason why it's not is because we're looking at the thermo effect of food, or how much energy it takes your body to break that down into usable nutrients. We look at a few studies here. We have postprandial thermogenesis, so after we eat, at 2.5 hours post-meal, averaged about twofold higher on the high-protein diet versus the high-carbohydrate diet. So we're starting to see now that the body it takes more energy to break down proteins than it does to break down carbohydrates, which is very beneficial for us when we're talking about producing a thermogenic or a weight loss, fat loss effect. The conclusion of this study indicate an added energy cost associated with high-protein, low-fat diets, and may help to explain the efficacy of such diets for weight loss. This study showed that a calorie is a calorie, the myth that we're talking about, violates the second law of thermodynamics. There is a large literature on this subject, and the general conclusion, as summarized in a recent review, is that the thermic effect of nutrients, approximately 2 to 3% for lipids, 6 to 8% for carbohydrates, and 25 to 30% for proteins. So we can see that consuming higher protein diet, lower carbohydrate diet will net you a greater energy consumption or a greater ability to burn calories, just to break down that food. This is the thermo effect of food. So the take-home message is protein has the greatest thermogenesis when compared to carbohydrates. Calorie is a concept of macronutrition and poor interpretation of the data and rooted nutritional principles. Protein, fiber, and fat increase satiety, thus reducing consumed calories while lowering cortisol and insulin balance. When we consume foods higher in fiber and fat, we're purposely slowing down digestion, so you will stay fuller longer. That's why folks that just eat a strict protein shake in the morning, they're usually starving an hour later. I usually recommend them add a little bit of coconut oil, some almond butter, sunflower butter, to increase the fat content, and that'll keep you fuller for a longer period of time. So this is the hope of all of us. Inside me, there's a thin person struggling to get out. Hopefully, he's burning a lot of calories. This has to be the longest running myth that I know of, that breakfast is the most important meal of the day. You have to eat breakfast to be successful. They've done a few studies that show that breakfast is the most important meal of the day. It helps increase attention spans. It increases brain function, so on and so forth. Then there's the same amount of studies on the other end that show that breakfast has no merit and no weight on any of those functions. So what we're looking at here is breakfast actually does not increase metabolism. There's a lot of correlation studies, but not causation, meaning that we're not seeing that we can just say, okay, when these people ate breakfast, they're getting this effect. Or when these people didn't eat breakfast, they're getting the opposite effect. There's really none of those out there. The meal itself is not as important as the food choices. So just to wake up in the morning, you're running late, I have to eat something, you're going to reach for one of those sugary breakfast bars. Honestly, you're probably better off skipping it completely. And that's what's important, is the food choice. So in November 2013, they did a study to look at the evidence. They kind of took everything together. I found this summation study, which took a lot of the research that's out there on the topic of consuming breakfast. This was published in November 2013, and they concluded that there's a lot of research bias, and then there's a lot that's also lacking probative value, which really makes a lot of these studies, once again, like most things, highly financially driven, possibly by the agricultural industry. So the take-home message is, if you're hungry, eat a quality breakfast. If you're not, skip it. It's not that big of a deal. There are some individuals, of course, like I said in the beginning, you do need to consult your doctor whenever you make drastic changes to your life. There are some individuals that will have a hard time skipping breakfast. Those that have impaired glucose control is something that comes to mind. So breakfast is fine, but not most important. If you are going to consume breakfast, we do want to make it a good quality breakfast. Here's some ideas. We have protein shakes. You add a little bit of fat, like I said before, to keep you satiated longer. If you want to add a little bit of fruit, it has to be low glycemic fruit. Remember, we're making a protein shake, not a fruit smoothie. Just as a general rule throughout the day, if you want to consume fruit, you need to balance it with some veggies. So nice colorful veggies in a 3-to-1 ratio to fruit is a good ratio to stick with. You can also have eggs, meat, and nut breakfast, which would be whole eggs, lean red meat, fish, chicken, turkey. There is no such thing as a breakfast food. Any food will do. I know individuals that drink, that consume soup for breakfast, or they'll have a piece of salmon or fish. Leftover dinner is one of my favorites. It's easy, it's quick, it's efficient. And then you could always add low glycemic fruit. I don't really recommend you just leaning on fruit as your whole breakfast. I'd like to see it as just a small addition. If you want to have some eggs and some lean meat, and then have a little bowl of some dark mixed berries would be ideal. So meal frequency. We hear a lot, eat 6 small meals a day for the ultimate weight loss. It's said because it boosts metabolism, which is false. You won't be hungry, which is also false. And you'll consume less calories, which is not true. It is true that digestion does increase the thermo effect of food. Like I said, whenever you consume a certain nutrient, it does take a certain amount of calories to break down that nutrient. Protein, of course, is the greatest. But it's usually negated by the amount of calories eaten. So if we have 3 meals at 300 calories, it's 900 total calories. And if we have 6 meals at 150 calories each, we have 900 total calories. So at the end of the day, it's really total calories consumed, not how many times you ate the calories. The thermo effect of food for the extra meals in between is totally negated by the total calories. So honestly, there is no difference. And let's look at some research. Increased meal frequency does not promote greater weight loss in subjects who were prescribed an 8-week equal energetic, energy-restricted diet. We conclude that increasing meal frequency does not promote greater body weight loss under the conditions described in the present study. So they had individuals who would have snacks, and then they had other individuals that just ate larger meals, and there was no difference at the end of the day. In another study, they looked at the thermogenesis in humans with varying mealtime frequencies. The results demonstrate that the meal frequency did not influence energy balance, meaning that we're not getting any extra energy burned from having increased meal frequency. Is there any positive to eating multiple meals? Not really. Honestly, if you eat multiple meals throughout the day, you're keeping insulin really high, and there needs to be a proper balance of insulin and cortisol throughout the day. We're made to eat and then fast. Whether it's short-term or long-term, we have proper hormones to allow that to happen, and it's supposed to happen. Meal frequency has little to no effect on weight reduction, which we just showed you, and total caloric intake is king. And then here's another study that said that the effects of meal pattern on the regulation of body weight are likely to be mediated through the effects of food intake side of the energy balance equation. So once again, snacking or having 6 small meals a day does not prove beneficial as far as weight loss goes. So what do we do? I think maybe some of you so far have seen some new and interesting things, and now you're asking, well, everything I thought was true is no longer true. So, what are we to do? I laid out some things here. This is called intermittent fasting. Intermittent fasting is taking advantage of the body's current energy stores and its ability to regulate itself through short-term fasting periods. There are multiple ways to fast, and I wrote down the most common ones here. So we have 24 and 48-hour fasts. We then have 12 to 14-hour fasts. And then we have a 20-hour fast. You can mix together all of the above. You can just stick with one. For me and my patients, I really find that the 12 to 14-hour fast works best. It allows you to have about 2 to 2.5 meals a day, depending on your lifestyle and your waking hours. So you would just skip one meal. Most commonly, folks start out with skipping breakfast. They already want to skip breakfast usually, but they're consuming breakfast because they're told it's the most important meal, which we know now isn't. So that's a good way to start off. Skip breakfast, have a really good high-quality lunch, and a really good high-quality dinner. And then you can see maybe day 2, you can have your breakfast, you skip lunch, and then you can have dinner. And then you can play around with it. You could skip 2 meals if you want. You really need to see how your body responds and how good you feel. Are we getting more energy? Are we more sluggish? Are we going for more of that aesthetic performance? Are we consuming enough calories? So like I said, this is multifactorial when you choose a diet. It's all about your goals. What are you looking for? Here's some benefits to fasting. Obviously, we're avoiding allergies. If we're not consuming food, we're not consuming food allergies. We get something called mitophagy and autophagy, which is the body's natural detoxification of those energy-producing organelles. They become bad, for lack of a better term. They become dysfunctional for whatever reason, and the body, when we fast, will actually clear out the bad ones and replace it with good ones, which is very, very beneficial for overall health and energy production. We decrease gastric inflammation because we're not consuming anything that may be harmful to the gastric lining. We lower blood pressure, lower glucose. We reverse insulin sensitivity. And obviously, this isn't the most important fact, but we also lower food costs. If you're not eating 1 meal a day, you're saving yourself the finances behind that 1 meal. So here's some research on the benefits of fasting. Like I said before, we upregulate autophagy. And in this study, we see that autophagy is actually neuroprotective. Our observation that a brief period of food restriction can induce widespread upregulation of autophagy in the central nervous system. We see that it has very beneficial effects in neurodegenerative disease. And then they go at an example. In vitro models have shown that starvation in the neural cell lines can remove toxic molecules and damage mitochondria from neurons. To give you an example, in vitro model have shown that starvation in neuronal cell lines can remove toxic molecules and damage mitochondria from neurons. That's that mitophagy we talked about. Other tissue cultures of mutant proteins listed here are associated with Huntington's disease and familial Parkinson's disease have identified autophagy substrates that can be removed by drug-induced enhancement of autophagy. Not my favorable way of inducing autophagy, but they would give these individual drugs and they would actually see these diseases improving because of the enhancement of the autophagy, or the body getting rid of the bad cells, the bad mitochondria, and allowing the new ones to take their place. Here's another study that shows resting energy expenditure in short-term starvation, so we're talking about that intermittent fasting again, is increased as a result of an increase in serum norepinephrine. Resting energy expenditure increases in early starvation, accompanied by an increase in plasma norepinephrine. This increase in norepinephrine seems to be due to the decline in serum glucose. So as we limit glucose, we're starting to get an increase in these neural hormones. In this study, we're going to look at alternate day fasting, which is obviously 24-hour fasts. Can be difficult for some individuals. I myself prefer the 12 to 20-hour fast, but here's some positive research for the alternate day fasting. Human and animal results follow reduced cardiovascular risk, reduced risk for cancer, reduced harmful blood lipids, reduced inflammation, triggers new cell growth, which is beneficial, and improves appetite control. Some pretty powerful things just from limiting your food. Speaking about food, we're going to touch on the paleo diet as we wrap this presentation up. The paleo diet is more of a food group. There's no limitations. You're on a paleo diet. There's no calorie restriction or anything like that. It's what foods actually fit into that category. So what is paleo? Paleo is fruits, nuts, seeds, berries, lean sources of protein, and veggies. There's nothing more. There's nothing less. Some folks argue about cheese and milk. The paleo diet, there's a little humor here, was built off of, caveman and what caveman ate. And there's some argument in the industry of whether caveman could milk a cow or not to produce his own cheese. So in conclusion, I think everybody's unique, and each diet should be formulated to a specific individual and their overall goals. So you need to really ask yourself, what are your goals? Is this something long-term or short-term? Are you just trying, like I said, to fit in that wedding dress or to look good on vacation with your significant other? Or is this something you want to do for the rest of your life? Probably the biggest question is, does it make sense? And then for certain individuals out there watching this is, there's that performance health equation. Sometimes we do things to perform better that may not be the healthiest. That's something you need to decide. As always, are we listening to proven science, or is it clever marketing? The best overall, this is obviously my personal opinion. I like the research and observational results from a well-planned intermittent fasting protocol utilizing Paleo-Mediterranean style foods. And what I encourage my patients to do, if it's just for general health, I'd like to see you follow this in about an 80-20, meaning 80% of the time we're really following this very, very strict. 20% of the time, if you want to slip and have those foods that, maybe just have a little bit of, you want to have some dark chocolate, or a little bit of extra sugar, maybe you have some almond ice cream or coconut ice cream, you can go ahead and do that. We're preventing disease progression. If we're already having something going on, we're obviously going to want to err more on the side of being strict. So we're looking at a 95 to 5%. And then if we have some kind of neurodegenerative disease or something that's very rapidly progressing, we obviously want to stick to this as close to 100% as possible. Some folks say it's too tough to fast. I'm just starving. There's no way anybody can do this. And what I find, if we introduce caffeine, whether in the form of organic green tea or some black coffee, it will actually stimulate your body's own sugar production and allow you to get through that fasting phase. So if this is new to you and you want to try it out and you're having a really hard time, you're getting very irritable in between meals, try having a couple glasses of some organic green tea to see if that doesn't help you. And then there's also some benefits to having a little additional caffeine. It's a recent study published in Nature of Neuroscience. They took 160 individuals. They were shown a series of pictures. Half of the group consumed 200 milligrams of caffeine, and the other half did not. They took a placebo. They found that the next day when they showed them the pictures, and they had changes to these pictures, that the folks who consumed the caffeine were better able to recognize the changes, where the folks who had the placebo were not. And just as reference, organic green tea has about 40 to 120 milligrams of caffeine per 6 ounces, and black coffee has about 80 to 200 milligrams per 6 ounces. Once again, what works best for one may not work best for another. You need to educate yourself, set yourself a goal, get a baseline with a doctor, do some blood and functional testing to find out exactly what your energy status is, how well your body is processing glucose. Are you currently toxic? What do your sex hormones look like? Are they in balance? Current detoxification status, and just general overall health. You want to build a team. Depending on the person, this could be just a one-man band, like I say. You can rely on yourself, do your own research, but most often it's at least one other individual, and that could be a doctor, personal trainer, nutritional coach. Don't be afraid of setbacks or changes. Once again, what works for one may not work for another. What you read online or in a book that worked for 100 people, you may be that 101 person that it just doesn't work for. So you're going to go through highs and lows as you go through this process, and it's a learning experience. You will find out more about yourself, and it's all about what you do to make those changes in your lifestyle to get to the goal that you've set for yourself. In summary, meal frequency does not improve weight loss unless it's combined with calorie restriction. Like we said, calorie restriction is king. Whether you eat 3 or 6 meals a day, if you're still eating 900 calories, you're still eating 900 calories. Breakfast is no more important than any other meal in healthy individuals. Intermittent fasting provides higher sustained energy outputs with voiding off certain diseases. It's easy and it's inexpensive. We're not adding any kind of supplementation or drugs. And we're, obviously skipping a meal or two, so you're saving a few dollars there. A calorie of carbohydrate does not have the same effect on the body as a calorie of protein. So a calorie is not a calorie. And as we showed, protein has the highest thermo effect of any food. Consume paleo-style foods for the greatest nutrients. We get a lot of phytonutrients and micronutrients from paleo foods. And of course, we always want to reach for non-GMO and organic foods. We really need to stop poisoning ourselves. This is the number one question I get after I talk to my patients about some of these concepts. They're like, well, what do I eat? Low glycemic fruit, dark berries, cherries, and grapefruits. You want to avoid the tropical ones as they tend to be higher concentrated in sugar. You could just go online into your favorite search engine, type in low glycemic fruits, and you'll get a whole list of them. I think you'll be surprised that some of your favorites, you'll be able to still consume. Lean proteins, wild-caught fish, free-range beef and chicken, and eggs. Colorful organic veggies, kale, carrots, cabbage, artichokes, peppers. Each one of them have a unique healing property to them. Artichokes and asparagus may help with detoxification of certain hormones. Colorful veggies have high antioxidant values. This is where you want to do a little bit of your research or ask your physician, which ones they prefer you eat. Nuts and seeds are always a good addition for protein and fat. Just try and stay away from peanuts. Supplement for success. This is always really important. We get as much as we can from our diet, but our current food situation, it's hard to get some of these micronutrients. That broad spectrum, high potency multivitamin will help push that Krebs cycle for that ATP, that energy currency we talked about before that's made with the mitochondria. Whey or pea protein isolate is really good. Some of my favorites to get a little extra protein in there to increase that thermo effect of food while keeping you full throughout the day. Glutamine powder is good for multiple reasons. It's a good addition. It's pretty tasteless too. Probiotics on rotation. This helps with that normal gut flora, helps you digest and assimilate your nutrients properly. For sports and weight loss, you may want to add some hormonal support. 7-keto DHEA is pretty popular. DHEA itself. DIM, indole-3-carbinol, all helps with the metabolism of hormones. Creatine monohydrate. This helps with building some lean muscle. Joint, ligament, and tendon support, especially those who are currently in pain or under rigorous activity. You do want to protect your joints. Antioxidants, of course, N-acetylcysteine, glutathione, organic greens, vitamin C, vitamin E. And acetyl L-carnitine or L-carnitine will really help to push that fat-burning metabolism, really start to stimulate that ketogenesis. I hope you all enjoyed this presentation. As always, if you have any questions, leave them in the comment box or feel free to email me. All of my information is here. I look forward to speaking with you in the future and helping you and answering any questions you may have about yourself or your friends and family's health. Once again, thank you for everybody that's joining us in different locations. I'm glad you were able to make it.